The Positive Effects of Social Media on Health by Era Satminsky. Social media has become a common way for people today to connect, whether it's through apps or websites or videos or networking services. In some ways, social media has taken the place of many of the face-to-face interactions people used to have. Since social media plays such a large role in our day-to-day lives, it can be understood that it must also play a role in our health. Therefore, it's important for us to explore the positive uses of social media for our health and the implications it has for the future of healthcare. This presentation will focus on three main areas of health that are affected by social media. Those areas are physical health, mental health, and emotional health. Physical health is the condition of your physical body. It includes diet and fitness and physical diseases. Mental health refers to the psychological well-being of a person and the ability of that person to process information. Emotional health is how a person expresses their feelings. It also includes their professional and personal relationships. The first area of health we're going to cover is physical health. It's probably the area that most people typically think of when talking about health. Before we begin, I'd like to talk about some statistics in the United States to give you an idea of what health is like here. According to the National Center for Health Statistics, heart disease was one of the top 2 leading causes of death in men and women from 2007 to 2017. Heart disease is a chronic health condition that is preventable with proper diet and exercise in most cases. High blood pressure is one of the leading preventable causes of cardiovascular death in the U.S., and the rates of high blood pressure in people over 20 years old have remained relatively unchanged from 1999 to 2016. As I mentioned, just like heart disease, most high blood pressure is preventable. Obesity is another cause of heart disease and death. In the U.S., the percentage of children, teens, and adults who are obese has increased from 1999 to 2016. And again, obesity is a preventable condition. Social media has the potential to improve all of these statistics. The development of social media health apps can help people better manage their own health and improve things like their diet, weight, and physical activity. An article by Timmons discusses the best health apps of 2019. Apps like MyFitnessPal and MyDietCoach Weight Loss allow users to record their food intake and physical activity each day while connecting them with a community of like-minded individuals. These apps help people set goals and hold them accountable so that they have a better chance of being successful. By using social media to connect these individuals with their peers, they can discuss things like tips on what worked and what didn't. Sites like Instagram and Pinterest can also inspire people to be healthier by sharing pictures of healthy meals, recipes, and fun workout plans. These types of apps could help reduce the rates of obesity and high blood pressure in our country. Timmons also mentioned some medical apps. Apps like HealthTap and First Aid American Red Cross connect people with medical professionals in some manner. HealthTap allows users to browse medical articles so that they can research symptoms and medical conditions. It also allows users to ask a doctor questions without paying any fees. First Aid American Red Cross gives users access to instructional videos and animations that guide them through first aid scenarios. The app can even connect users with 911 in case of an emergency. It is important to note that since social media makes health materials so available, audiences do need to make sure that they are getting their information from reputable sources. Social media also has the potential to balance some of the health inequalities in our society in areas of socioeconomic status, location, and physical disability or age. People in poorer and rural communities may not have the same access to medical professionals because they may not be able to afford it, or it may be too far away. This also applies to the elderly or disabled. It may not be easy for them to leave their home to get to medical professionals. However, most of these people do have access to social media through mobile devices, home computers, or computers at libraries. In an overview of review articles by Welch, it was found that the anonymity of the internet could help promote health-seeking behavior in harder-to-reach at-risk groups, like the elderly and those in a low socioeconomic status. The social media interventions on health were most effective when a moderator was involved to help guide people's discussions and answer questions. A moderator could also help to reduce some of the possible downsides of social media by removing or limiting users with negative or incorrect information. If these health applications could be used in more well-known social media sites like Facebook or Twitter, where many people have an already established community, it could have an even greater positive effect on health inequalities. The next area of health I'd like to talk about is mental health. Mental health plays a very important role in our overall well-being, and it's a growing concern in the United States. According to the National Center for Health Statistics, life expectancy at birth has decreased since 2015, and suicide and Alzheimer's disease have contributed to this decrease. This is a startling statistic because for many years, it was always assumed that children would outlive their parents in terms of the number of years they'd be alive. However, if we continue on this trend, that won't be the case. In recent years, the news media has been talking about the negative side of social media on mental health, like through cyberbullying. So therefore, it's even more important that we need to be aware of the positive way that social media can impact mental health. Just like there were apps developed to improve physical health, mental health apps are on the rise. Going back to the article from Timmons, he mentioned apps like Elevate Brain Training and Lumosity Daily Brain Games that are designed to improve memory, focus, your critical thinking, and problem-solving skills. These apps are designed to be fun and interactive. Plus, you can share your results and progress with friends. These types of apps can help combat the aging process of our brains and improve mental health, possibly preventing diseases like Alzheimer's. The sense of community that social media provides can also be a place for people with mental health conditions to come together without having to physically be in the same room. On social media sites like Instagram, YouTube, or Facebook, the successes of one person can inspire another. Arusha Nakonam, a woman struggling with anorexia, found motivation from these community apps. She said, "They inspired me to push through my recovery so I too could focus on physical strength, which made the dark times and hard moments in my recovery easier to push through. I saw a reason to succeed. I saw something I could be." These are powerful words from someone who has experienced firsthand the positive health benefits of social media. These platforms have the potential to help people on their path to recovery. With these same community apps, social media can help with an everyday mental health concern for all of us: stress. Social media can help to reduce stress through the videos and images we share. Recent studies have found that cute animal photos and videos can make us more resilient to stress due to an upward spiral of positivity, which is when one positive image or video causes your next thought or action to be positive, then the next, and so on, until you are less stressed and in a better mood. Take a moment to look at these cute animal photos. Even if you're not a dog or a cat person, it's hard not to smile when you see them. These pictures not only improve your mental health, but your emotional health as well. Although those cute animal pictures were effective, cute animal videos have been found to have the greatest impact on emotional health by uplifting your mood, part of that same upward spiral of positivity that reduces stress. Research has also shown that any positive videos can have this effect, and there are many available on social media sites like Facebook and YouTube. Social media can also be a way for people to get emotional support. Discussion groups and forums can be a place for people to express their feelings in a safe space, since they can do it anonymously. While this may not appeal to all people, for those who have social anxiety or are unable to get to physical support groups, these social media sites can help improve the emotional health of their users. Social media can also have a positive effect on our relationships. Apps like LinkedIn and Meetup can help improve our professional relationships. These sites connect people locally and across the world to improve business relationships and share knowledge. Social media has also become a place for people to form personal relationships. Most of us probably know at least one person who has met their significant other on a dating app. Although romantic relationships can begin online through dating sites or even Facebook, people that are serious about turning the online relationship into a more intimate one eventually meet in person. Since this method of meeting a partner is becoming more common these days, safety measures should always be taken, such as letting a friend or family member know where you are when you go to meet with someone. For people who frequently travel, or for those with social anxiety, this method of forming relationships could be a good option in order to prevent loneliness and maintain good emotional health. The impact that social media can have on an individual's physical, mental, and emotional well-being can be great. By understanding how social media can be used to benefit the health of our society, people will be able to make more educated choices for their own health and the health of others. The rapid increase in the development of new social media health apps and websites shows the desire of our population to use this platform in a positive way to improve their health. If people embrace the beneficial possibilities of social media on the future of healthcare and health promotion while being mindfully aware of its downsides, it has the potential to have a lasting positive effect on the health of our community as a whole.